Thank you for joining Congressman Mark DeSagnier's virtual hands-off our healthcare town hall with special guest Matt Herdman, California State Director of Protect Our Care, a nonprofit dedicated to ensuring affordable, high-quality healthcare for all Americans. My name is Janessa Oriel, and I'm the District Director for Congressman DeSagne. Tonight, you'll hear from the Congressman and Mr. Herdman on how House Democrats are working to protect healthcare for millions of Americans who rely on the Affordable Care Act. We will then take questions live. To ask a question through Zoom, please submit it through the Q&A box at the bottom of your screen. And to submit questions through YouTube, please add your questions to the comment section. I will now turn the town hall over to Congressman DeSagne.
Thanks, Janessa. Want to thank you all for joining us, and I want to particularly thank Matt. He's been in demand, I understand, from a lot of Democratic offices so that we can explain a little more detail about what is at stake here in this shutdown and what, unfortunately, the president and the majority leaders in both houses, from my perspective at least, what's driving them. So we're going to start with a brief PowerPoint from me and then turn it over to Matt, and then we'll go to questions. Thank
Yes, apologies. Just working on, apologies. I'm having some
That's all
technical
right.
difficulties, but I'll get it up in just a moment.
Okay, I can talk. You know, I can fill the time. I'm a professional talker. Anyways, again, thank you for joining us. We're in a third week now, the shutdown. There are a lot of moving parts to this. Just as way of background as we get to the PowerPoint, having been in world healthcare here in Contra Costa and in Alameda counties for a long time, first as a business owner, from that perspective, a small business owner, trying to be able to afford healthcare as an employer, and then on the city council, mayor, and then in particular as a county supervisor, 4 terms on the county board in a county that does a really good job at trying to make sure we have health care for everybody. And then in the legislature, I served on the policy committees in both houses of the health committee, and in the Senate, I was the chair of the budget committee related to health and human services, and now in the Congress as the ranking Democrat on the Health, Employment, Labor, and Pensions subcommittee that deals with 120 million Americans who have health care through their work, through their employer. So all of that gives me a background at the state and local level and the private sector of what we're challenged with when we're moving parts of a very complicated and I think inefficient healthcare system. I like to say we have the best healthcare system in many ways in the world and the least efficient of the developed countries in the world. So let's run through the PowerPoint so we have plenty of time to answer your questions. So we've now, as I said, in 3 weeks, this is the longest government-wide shutdown in American history. Our Republican colleagues have been unwilling to negotiate. I voted against both the Big Ugly Bill, which is an important part of what we're voting on now. Actually, there's 3 parts to this. In the first Trump administration, the Republicans had control of both houses and the White House, and their big accomplishment was the largest transfer of wealth from the vast majority of Americans to the very wealthiest. You can verify this by going to the Congressional Budget Office, a nonpartisan, well-respected required by law to be nonpartisan, and their evaluation of that bill. But they set a sunset on it that just came up, or was about to come up, when they took control again and now have the majority of both houses of the Congress and the White House. So that's important to know because that was a key component of the Big Ugly Bill, and that extended the deadline for the tax change in the first administration that transferred this wealth at a time in American history where the concentration of wealth is already the most extreme in the history of the United States, and is historically a very dangerous thing in a developed country. Thomas Piketty was recognized a French economist who gave a rich history of this probably about 6 years ago when he wrote the book Capital. So that's an important part to consider. And then in the Big Ugly Bill, the Congressional Budget Office and the Kaiser Family Foundation said that that bill, by cutting the money into Medicaid, Medi-Cal in California, would eliminate healthcare for up to somewhere between 14 and 17 million people based on different evaluations and regarded nonprofits and the CBO. So those are important parts to remember, because then we have this, and my Republican colleagues like to say this is a clean resolution, and it's not, because it's tied into those movements of transfer of wealth and who's going to pay for it. The big ugly bill and this CR will extend, according to the CBO, increase our national debt deficit by $3.5 trillion over the next 10 years, and at the expense of most Americans' healthcare and other programs that have worked, and transfer that wealth. So that's why we're holding out. I voted against both the big ugly bill in the last session, or before this, and I voted against that. That bill is now in the Senate, and that's where it's stuck, because that requires 60 votes in the Senate, only required simple majority in the House. So they didn't get any Democrats to vote for that. And now this is where the shutdown is. In the Senate, as Democrats refuse, as we all did in the House. But in the House, it only required a simple majority. In the Senate, it requires 60 votes. In the big ugly bill, because they were taking money out of already appropriated bills, it only required a simple majority in the Senate as well as the House. So that's why we're shut down. And for me, it's a very principled, important fact that we do not capitulate. We're willing to negotiate, but they have to come to us in good faith to negotiate a solution to this crisis. They knew they needed 60 votes. I don't know why they didn't engage the Democrats that they needed the votes for in the Senate before. But my suspicion is this was hostage taking by the President of the United States, and he thought we would capitulate. We're not, for good reason. Next. So this part is about the subsidies under the Affordable Care Act, which Matt will talk more about, but this is the key part of the continuing resolution, as opposed to the damage they already did in the big ugly bill. So this is really going to affect a lot of small businesses. We're going to do another town hall just about that. As a former small business owner, I can speak to the success of the ACA, in my view, and why it's important that we continue to support people who are able to get this additional funding, and it's good for all of us. It's good for the economy, because we need to make sure that people can afford health care. And in America, a lot of people can't. And then they end up in the emergency room with very much higher needs, higher acuity, and higher cost to everyone. But particularly for those people who can't get to a primary care doctor because they're not continue to have these subsidies. Next. I just always like to bring this up because there's a mythology in the American population about who's the fiscal responsible party and who isn't. This is a very visual demonstration during Republican presidencies since H.W. Bush. It's gotten progressively worse in administrations where we get further in debt. So I always like to explain to people, as a former Republican who was a numbers person in a small business world, the need to be fiscally responsible is important, and the Republicans have not, in my view, for quite a while. Beginning in the W administration, HW got a little bit, but in the first Trump and now in the second Trump, the perception that they are the fiscally responsible party is just not factual. And this demonstrates that. Next. So again, the Congressional Budget Office, by not having the PTCs extended, that's 2.2 million Americans, according to CBO, that will switch and become uninsured. So the more uninsured you have, the more they end up in the emergency room. And I was just out at the county hospital in that emergency room talking about the effect for them, because for what's referred to as indigent care in California, that's the provider of last resort by law. So taxpayers pay for that. and 7.5 million, as you saw in that last bullet. So these are the premiums. We're already seeing them going up. This is a lot of the jurisdiction in my committee when we are in the majority. Democrats have the chair of the Health, Employment, Labor, and Pensions Subcommittee. The other jurisdiction in the House is in the Energy and Commerce Committee that used to be chaired and ranking member by another Bay Area member, Ann Ashew, who just retired. But this is where you're already seeing your premiums go up because the insurance providers, amongst other reasons, can see the pressure on the system and where they have to protect themselves and the hospitals and the providers themselves. They're raising them. And at the same time, we've done hearings in my subcommittee where the denial of traditionally approved claims under your legal contract with your insurance companies is going up substantially. And part of the reason for that is most Americans don't have the wherewithal to challenge the denials that they're now getting that historically were approved. And the Republicans have cut the regulators. We have only one staff person for every almost 14,000 health insurance programs in the United States. So the bad guys in the insurance business understand that it's going to take us a very long time to actually investigate these claims being denied. And that puts pressure on the ethical providers they have to compete. Do they deny claims illegally? Because there isn't enough enforcement and not enough Americans have the wherewithal to get an attorney to file a suit. Very similar structure in the mortgage disaster, where they were denying people who had legitimate problems with their mortgage holder, and it was very well constructed, unfortunately, in a very unsatisfactory way for Americans to be able to actually get their legal protections. Next. So here's the significance to California. Having been very involved in the legislature when we were doing the Affordable Care Act in California, and I think we did it very well under very challenging times, it's going to really affect people in California. And again, it affects all of us. All of this is connected, and the taxpayers are connected to the consequences of our actions in terms of the quality of care for everyone. So there's a web here that's connected, and as you start to tear the web out, strand by strand, the web collapses. Next. So we're not just against this. We have a proposal. We have tried to introduce our appropriations fix, and it's very simple. We go back to before they changed the appropriations from last year, and then we go forward by extending these subsidies the way they should be because they've worked. And I don't like the word subsidy, but that's the terminology right now. It's a better complement to a more efficient healthcare system that is integrated more like the rest of the developed world. It's still not where we should be, but that's why we're holding out. So I'll stop there and toss it back to Janessa and give time for Matt, and then we'll entertain questions. Thank you.
Thank you, Congressman. Apologies. Thank you, Congressman. We're also joined by Matt Herdman, California State Director of Protect Our Care. Matt is a healthcare advocate with a decade of community organizing, campaign, and advocacy experience. Since 2022, he has been the state director for Protect Our Care, where he fights for higher quality, more affordable healthcare for all Californians. Matt, thank you for joining us. The floor is now yours.
Thanks for inviting me, Representative. So by way of introduction, I had sort of bounced around a few jobs when I was younger, and one that sort of will always stick with me that sort of changed the course of my life was that in 2014, I was doing work during the first open enrollment period when the ACA was just brand new, and there was a lot of pressure over how will this work out? Will people be able to get insurance? Will it actually be affordable for them? And I was running a community program that went out in San Antonio, talking to people and getting them signed up for health insurance. Because for many people, the health insurance was going to be able to be, a couple dollars a month. maybe $50 a month, depending on your income levels, where you were, all those sorts of factors. And people knew that there was something about Obamacare, but they didn't really know anything about what it was or what it could mean for them. And it was the most incredible few months of my life because I spent the entirety of the time talking to people and saying, hey, health insurance might be more affordable for you and your family than you ever might have thought. And you would have these constant conversations day in, day out where people were like, oh, I can afford this. And they would talk about it in the way of being like the first person in their family to have health insurance, the way people talk about being the first person in their family to go to college or other milestones like that. And it was so eye-opening and so powerful. And it was this real sign of like, we are making it so that more people have health insurance than ever before. And that's true. Right now, today, a greater percentage of Americans have health insurance than at any point in US history. And that's been driven by Democrats passing the ACA and Democrats passing the expanded tax credits that were passed under Joe Biden that Representative DeSaulnier was a major part of championing. This is something that is a kind of a huge accomplishment when you step back and think about it. So right now, about 24 million Americans get their health insurance through Covered California or different state exchanges or the federal exchange. And about 20 million of those folks are able to afford them because of these tax credits. So that's 20 million Americans. In California, it's 1.7 million people who get it through Covered California, and about 1.5 million of them get it with these tax credits. And I mention those numbers because a lot of people don't necessarily know that they're getting the credits, right? It's mentioned when you sign up for them, but it's not like when you pay your health insurance each month, it's like, well, this is $500 a month, but it would have been $900 a month if it weren't for the tax credits. So this is kind of an invisible benefit that a lot of people get that's making it so that more people can afford health insurance than ever before, but a lot of them don't necessarily know that they're benefiting from it, which is creating a really potential for a toxic storm now that Republicans are working to get rid of these tax credits by not extending them. So in terms of the timeline, October 15th, so a week ago, California had its window shopping period open. So you can go right now, Covered California's website, to their look and see page, and we can drop a link to that in the chat, I'm sure. And you can see in your zip code, how much will health insurance cost, an average silver plan, a bronze plan, what's available for you. And you can compare from 2026 back to 2025 and see what those different plans would have cost. And for most people, the plans are going to be about twice as expensive as they were last year, purely because of the ACA subsidies going away. Now, there's also a little bit of healthcare or premium increase in costs that happens naturally year over year in the same way that inflation comes for everything. But the bulk of that doubling comes simply because Republicans aren't willing to extend these ACA tax credits. And this has a huge impact. So about 1 in 6 Californians have used Covered California in the past decade to get their health insurance. For many people, they use it when they're in between jobs, or maybe one job doesn't offer health insurance, but in a few years they get health insurance through their job. So it's that bridge that helps them have a continuity of care. And so of that 1.7 million Californians that currently get it, about 500,000 of them are between the ages of 55 and 64, folks where health insurance is incredibly unaffordable because healthcare costs rise as you get older. If you don't have those tax subsidies, people between the age of 55 and 64 are going to be even harder hit than everyone else. And about 500,000 of those 1.7 million are people that are self-employed. Those are small business owners, those are contractors, sometimes those are farm workers, people that are oftentimes more vulnerable and in tougher positions and relying more on, month to month. So the average increase for middle income folks, people making between 62,000 and 94,000 a year, family in California, for an individual plan, that's going to see a monthly increase of $502 a year. And for a family of 4, that's unsustainable, right? That could be 4 times as much, $2,000 a month increase. As sort of a thought experiment, I want you to think about if you had to find an extra $2,000 a month, or maybe your family has different circumstances and it's only $1,000 a month or only $500 a month increase, would you be able to find an extra $2,000 a month, $24,000 over the course of the year? Would you be able to find an extra $500 a month? That's $6,000 a year. For most families in California, that's simply not going to be affordable. And the way Republicans have done this, where they sort of snuck it in, and they're not really talking about the fact that there's letting these tax credits expire, means that folks haven't really had the time to plan, right? They're letting this chaos happen while open enrollment is just about to begin on November 1st. And many Americans simply don't know that their premiums are going to skyrocket because of Republican inaction. That's going to be really damaging because for many people, these are simply, they're not going to be able to afford that increase. and they'll go without. Of the 24 million Americans that get health insurance through the exchanges, it's estimated that as many as 5 million could simply just opt out of health insurance if the tax credits go away. And there's a little bit of uncertainty about whether it's going to be 5 million or 4 million. There's, estimates in either direction. But the top line is that millions of Americans could lose their health care if Republicans get their way. So this is a huge problem, both for those people, but also because, as Representative DeSaulnier alluded to, hospitals still have to provide emergency care to people who don't have health insurance. And uncompensated care is a massive cost for a lot of California hospitals. And when you couple it with the Medicaid cuts that Republicans passed earlier this year in the big ugly bill, hospitals have no idea how they're going to be able to cover the uncompensated care. So Protect Our Care is a hospital crisis watch where we're tracking which hospitals are in the toughest financial positions and might have to close different clinics or close different services or not be able to offer as strong of services as they have before. There's already 2 hospitals in the Central Valley that have said that they're closing their pediatric clinics and they're directing people to begin finding other providers for their kids. Because they're just not going to be able to afford to keep them open with the Medicaid cuts that have been passed and the likelihood that you're going to see the ACA tax credits go away if Republicans get their way. We could see that extend even further if these the tax credits do permanently go away because of Republican inaction. So the context that I want to bring this back to, though, is we have the opportunity to continue fighting for more people to get health insurance, right? Right now is the best it's ever been in terms of people in America having health coverage in some form or another, maybe through their employer, maybe through Medicare, maybe through Medicaid, maybe through the exchanges. But the job isn't done yet. And Republicans are trying to scale back that progress, whereas every single House Democrat that I've spoken to has said, we need to extend these tax credits. But not only that, we need to figure out how we can make healthcare a little bit more affordable for folks. Because just having health insurance isn't, that's like step 1 of the fight, right? That doesn't mean that you're able to get health insurance. And I love what Representative DeSaulnier talked about, how insurance companies are denying care that should be approved. I have a prescription that every 6 months I have to get the prior authorization reapproved, and every single time they deny it, and then every single time we have to resubmit the form. What's going on there is they just know that you're going to, some percentage of people aren't going to actually bother to file the appeal. So every single House Democrat wants to extend these tax credits, but they also want to fight to make healthcare more affordable, more equitable, and more accessible. So that it's not just having insurance, it's having insurance that works for you and your family. So with that, I'm going to pass things back to the Congressman and Janessa. Move along.
Fantastic. Thank you, Matt. We'll now move on to the question and answer portion of our town hall. As a reminder, if you'd like to ask a question, please use the Q&A function at the bottom of the screen for Zoom or submit your question in the YouTube comments. Our first question is, what is the reason that Democrats want to continue pre-COVID healthcare subsidies when we are now post-COVID? That's from Lynn. Congressman, I believe you're on mute.
I should know how to do that. I'm just always clearing my throat, so I don't want to interrupt. That's a reasonable question. So the reason, at least from my perspective, is because it's working. We're getting more people health care, and it helps the whole system. And just be mindful, of all developed countries, we have the highest cost, but the weakest outcome. So what that means is we spend about 1/5 of the total economy, the GDP, on healthcare in this country, which is higher than other developed countries because they have an integrated, more efficient system in Japan and Germany and England and France. And it's because everybody pays more. But the outcomes are better. You have longer life expectancy, less child mortality. So all of that is to say, that's a legitimate question. The reason why we want to continue it is, although COVID is over, the healthcare crisis isn't over in this country. And that's just my perspective. I don't know, Matt, if you have anything to add.
No, I think that's exactly right. I mean, we need to continue to fight to make sure that more Americans can get access to care, right? It's plain and simple. Do you want 5 million more Americans or 5 million fewer Americans to have health insurance starting next year? 2 months from now, you've got 2 worlds, one where 5 million people have insurance and one where 5 million don't. Democrats are saying, we know which side of the line we're on that. And Republicans are also, frankly saying which side of the line they're on. They're strong.
Just one last thing that I want to keep reiterating is it's not just because it's the moral right thing to do and people have longer lives, it's more efficient. You don't avoid costs by having a healthcare system like we do. We have amazing inefficiencies, and this has been my argument with my Republican colleagues. I thought Republicans were about making everything more efficient. Certainly, when I was a small business owner and a registered Republican, that's what I wanted to make the business survive. Restaurants have amongst the highest mortality of any business. So not having waste is a good thing. And right now we have a very, very inefficient system. So if these go into effect, just in Contra Costa, having been very involved with Contra Costa. And by the way, for all the trolls out there who say I get special health care, I don't. Congress might have years ago, but we don't get Cadillac insurance. My health care I've paid into for years, it's in the Contra Costa Health Plan. A great model, actually a very unique one because my predecessor in Congress, George Miller, actually allowed Contra Costa County to start its own health plan that then could be sold on the private market. So if you go to the exchange here, that's one of your options. So you're all in there. That's where I get mine. And the model here with our other partners, John Muir, Kaiser, Sutter, has been to make the system more efficient by doing primary care, doing prevention, making sure the school districts are aware of helping kids get good dietary discipline, so that all your life you're being more efficient in terms of just being aware of your own health care. The opposite of that is having everyone go to the emergency room when they get really sick. So by getting people to go to primary care, you don't develop diabetes problems. You don't develop lung cancer because you're smoking or drinking too much. So this model, just from an efficiency standpoint, to me, is madness because it becomes more efficient and people will die, but they'll have higher acuity by the time they show up at the doctor's office, as opposed to doing regular doctor's visits and visiting your primary care doctor in a primary care setting. And this is the madness of this. Now, why are the Republicans doing this? Because they believe the private sector will somehow jump in and make it more efficient. Well, when we were going through the ACA, we spent a lot of time trying to find a model that in that world. And the closest thing was Singapore. Very different circumstances, and the outcomes still aren't as good. So the private sector is not going to, from a historical perspective, be able to solve this problem. And in spite of that evidence, the Republicans and Mr. Vogt from the Office of Management and Budget wants to get rid of the New Deal, wants to get rid of the Great Society, which created Medicare and Medicaid, and wants to get rid of the ACA, which to me not only is immoral and unethical, but it's incredibly inefficient for all the taxpayers.
Thank you. The next question comes from Susan Hammer. How does the administration justify cutting the budget for healthcare and, on the other hand, approving $1 trillion for the military budget?
They don't. They misrepresent it. And it's, political consultants, they want to make everybody scared. So you blame it on people who don't look like you or from somewhere else. And then while they're doing that, they're taking the money to people like Jeff Bezos, Freudian slip, and people who don't need any more money. It's so that's what's happening here is a real calculated, and they believe it that this isn't a democracy. This is some kind of it's a republic for wealthy people who go to certain colleges, and they should rule and make the decisions, and everybody else, it's survival of the fittest. That's my perception.
Excellent. The next question is from someone labeled as anonymous. Republican messaging often refers to lazy young men who live with in their parents' basements playing video games and getting Medicaid. What is the genesis of this, and what data are they looking at?
It's just a mythology that they've marketed for years. That somehow, if you've done well and you have money, you've taken care of yourself and raised yourself up by the bootstraps. I mean, life is different from everybody. And if you start out in poverty, statistically, you're going to stay there. So I always thought this country was founded on opportunity, and I still believe that. And it benefits everybody. But this is part of the problem, is how we get information and being honest and having a legitimate conversation about things that we disagree with but on the goal is, I always thought this country was about equality and opportunity, that then everybody benefits from people's individual work ethic and their individual talents and abilities. That's not what the Republican Party believes in right now, from my perspective. If you were born in a wealthy family, somehow you should get wealthier.
One thing I'll
The
add,
next, oh yeah, go ahead.
Yeah, sure, Matt.
when it comes to the Medicaid cuts, Republicans were pushing this agenda constantly, talking about work requirements. Around 64% of people who are on Medicaid are already working full-time jobs. There's some that are working part-time jobs. There's others who are full-time working as caregivers for family members, or they're in full-time educational environments where it might not make sense for them to also be working a full-time job while also going to class full-time. The percent of people who are on Medicaid that aren't working and aren't also in school and aren't also caregiving, right? That the situation they're describing is vanishingly small. And one of the biggest tells for that is that they don't actually get that much cost reduction just by reducing those numbers, right? When you actually look at the math of how much money they save by cutting out that tiny percent population, it's basically nothing. So, they're going to fearmonger about that all they want, but the data doesn't really bear out. The vast majority of people who are on Medicaid are working.
Thank you. The next question is from YouTube. I'm concerned about the privatization of Medicare, having it administrated by insurance companies. I understand that's part of the Republican budget bill. Can you speak to that, please?
Matt, you want to take that one to start with, and I'll.
I'm not sure there's anything that's specifically talking about privatization in this, but there have been efforts. So, for instance, like Medicare Advantage is closer to a privatized model, but not quite exactly that. And there have been greater tendencies towards that. And I think it's pretty fair to say that most of those efforts have resulted in lots of companies getting rich and not a lot of folks getting actual high quality care. I don't want to overgeneralize, but I do think that that's fairly accurate. And it's kind of what Republicans want out of this, right? It's not too surprising.
And my perception is competition's good. That's part of the American ethos. I feel like in my life, I started off as um, uh, uh, in a kitchen, and then I ended up waiting tables, tending bar, and then I ended up saving enough money to be able to go into business for myself. So that sort of model is good, but you still need the rules to apply, because some people won't go by the same rules. They'll make up their own rules, which is the problem in our politics right now and in the White House. I think he doesn't think rules apply to him, and that if you go by the rules and you're ethical, you're a sucker. So this idea that the private sector can do everything in healthcare, I just don't think is based in the reality of human nature, that we have to have rules because some people will take advantage of it. And then the people who don't have to decide whether they stay in business or not. I saw this in the restaurant business. We progressively got worse in California because retail wasn't paying their sales tax, wasn't paying their workers' comp. I was the chair of the labor committee in the state Senate. We had huge problems with this. And it was because as we took the Reagan model in California from when he was governor, and then of course it went to the federal level when he was president. If you don't have regulators in the restaurant business, then people take the risk that they won't pay their sales tax, won't pay their workers' comp. And again, it created a drag on everybody else, people like myself, who did play by the rules. I used to compete, I'd say, with my CPA with other restaurants who had a 20% advantage. Now they had high risk because if they got caught, but because we didn't have the infrastructure, they decided it was a reasonable risk. And unfortunately, too many of them continue to be in business. So all of that is to say, we don't live in a free market economy. That's another mythology. We work in what's called a mixed market, where you create guardrails that everybody plays for, just like in athletics. And then you try to make those guardrails allow for competition and good spirited competition that's based on talent, ability, and work ethic. We've gotten away from that, where it's just survival of the fittest. And when you apply that to a fifth of the economy and somebody's personal health, it's a recipe for disaster, where people will die who don't need to die, because if they got the health care that they should get and the rest of the developed world provides for them, you'd be cured, or you would avoid more serious disease.
The next question comes from Dennis. So all the talk is about the shutdown regarding the premium tax credit, but I'm not hearing much discussion over why the healthcare companies can charge these enormous premiums in the first place. Is there any discussion in the Capitol about that?
Yes, and a lot of that comes in the jurisdiction of my subcommittee. But unfortunately, this has been a long time coming. I mentioned Reagan. It's just hollowing out the regulatory framework and the regulators. So people people who are in the for-profit business take advantage of that. And then the courts have allowed for more monopolies and concentration in all fields, but in this instance, in the healthcare field, there's less competition. We are lucky, I think, in the East Bay, because Henry Kaiser in Richmond during World War II created childcare for his workforce, because they were mostly women, because the men were out fighting the war, and healthcare system. So about half of the population of Alameda and Contra Costa get their healthcare from Kaiser, and it has its strengths and weaknesses, but it's a strength for us because it's a nonprofit, and it has generally held an ethos of we serve the public, and we're not being driven by constantly growing demands from investors on growth year over year in their profitability. At some point, there's only so much profit to be made by people who don't have anything less to give. And just back to the the increases that Matt was talking about, $500 to $2,000 a month. There is really good research, because of inequality right now, that almost half of Americans are $400 unexpected payment a month from not having enough cash to pay their mortgage and their bills. So we already have this fragile structure because of the greed and avarice of very wealthy people in this country. And you throw $2,000 a month, you got nowhere else to go.
I think one tangible thing that House Democrats did to try and bring premium costs down and bend that cost curve was the last time they had a governing trifecta, they passed the IRA, which forced prescription drug company negotiation. So there was a pilot program for 10, it's going to be expanded to more to make it so that instead of drug companies just being able to say, hey, for Medicare, you're going to take whatever price, we negotiate like the government would for any other thing that they buy. Which works to bring down costs. And while that's for Medicare specifically, what's been found is that oftentimes the Medicare price can become like a default price on the private market, and that can really bring up premium costs because the drugs prices aren't negotiated. So that's one tangible thing that House Democrats did, and I know there's a bunch of others that are being batted around for the next time they have the majority.
Yeah, Matt, just if I could piggyback on that, because of my committee and my background as a patient, I was very involved in that. This is another question. Why would a responsible party or governing entity not want one of its biggest cost drivers to be able to negotiate on the free market? If you believe in the free market, what is the madness of not allowing the federal government to negotiate better prices for their constituents, but for the country on prescription drugs? So I'll give you an example. I'm a survivor of chronic lymphocytic leukemia. Wonderful taxpayer provided research at the National Cancer for Institute in the National Health Institute that started in World War I, and they discovered what was causing it. Well, because of that, I, as an American, was able to get a prescription which saved my life. But the private sector, Johnson and Johnson, had the drug that did this, because they took the basic research. It's another problem with our system, and changed it just enough to get the copyright on what I take is called Veneclex. When I was on the oversight committee and we were in the majority, we had the CEO of Johnson and Johnson and Pfizer come and testify as we were negotiating these drug prices. In the case of the drug I took, because a lot of people have CLL, it was a very profitable market and it saved lives. Well, when I started taking it, it was $400 a day to keep me alive. Wall Street Journal did a series of articles on this because even upper income people, their copay, they had to make choices about whether they would make the copay or not. The same drug in Australia was $37 a day. And in the EU, it was $90 a day because they negotiated the best prices. So in effect, American taxpayers paid for the basic research and were paying higher premiums. So the costs were cheaper in countries that required negotiation. So you as a taxpayer were subsidizing people in Australia and in Europe to get the same drug that people like me had to pay 5 times the, 4 times, 5 times the cost. Part of what we did in the Biden administration was that was one of the drugs that negotiated. So now it's the same price as the EU. So that's an illustration of what Matt was saying is we did a lot in those 2 years that we had control of the White House in both houses when it came to healthcare, but it wasn't nearly enough. And the reason we couldn't do more was because it was a negotiation. We still needed to get squeamish Democrats in more conservative parts of the country to vote for it and try to get Republicans to join us.
And we have time for just one more question. This one is from Don. I believe the enhanced premium tax credits are not means tested, and thus the wealthy people can take advantage as well. Why not offer to limit to lower income individuals or families only?
Matt, you want to take that one?
Sure. So the way the tax credits are structured is that they take the benchmark of I think it's the second cheapest silver plan, and that amount, and you get basically, they take your income or your family income, and you can only pay more than a certain percent of your family income. So because it's based on percents, above a certain income, there's just like no way that you would ever get a subsidy. So they previously were capped at 400% of the federal poverty line. That was removed during COVID as part of the healthcare emergency. But in practice, very few people who are making more than that, and certainly basically no one who's making significantly more than that, actually do get subsidies in practice, and they get significantly smaller the more income you make. The subsidies are much larger for low and middle income families. And get vanishingly smaller, non-existent, the higher your income rises. So there's not technically a cap, but there is sort of in practice one. It's a little complicated, but.
Right. And I would add there's shockingly enough, in these negotiations, there is political influence on the people, the electeds who are in the middle of negotiating this. So it becomes more complicated and less transparent than it should be, my view. And again, that's another observation about how our healthcare system, if it was more transparent, like the rest of the developed world, this is a place where Americans should be really proud of parts of our healthcare system, like the research that's done at NIH. Extraordinary. By the way, the president wanted to cut in his original budget 40% of the National Institutes for Health budget and 37% for the National Cancer Institute. When I go back, the cut for cancer research is $760 million. I've spoken in committee and on the floor about that, how stupid that is, because for every dollar we spend at the National Cancer Institute as taxpayers, the CBO and others have projected that the American, what we get back for every dollar at NCS, we get $2.56 back into the whole economy. So it's called return on investment. Another place that supposedly Republicans are driven by. In this case, they seem to not recognize that. So we've gotten better from what Mr. Vogt suggested in the president's budget in the beginning of the year. So appropriations is better, but it's still stupid. Why would you cut an investment that more than doubles your return on investment and extends people's lives?
Excellent. Matt, do you have any final
The
comments?
vast majority of the majority of Americans view the shutdown as Republicans' fault. They control every lever of government, but they're not willing to even talk to other people who might disagree with them. That's kind of not how Congress should work, and it's disappointing. But I know the one thing that I do know for sure is that every House Democrat is fighting hard to make sure that we get extended tax credits and we get our way out of this shutdown. And I see a lot of cracks from Republican leaders who seem more and more concerned. They just lost Marjorie Taylor Greene, who was previously their most loyal soldier, who's saying, hey, these tax credits seem like a good idea. I think you're going to hear that from more and more Republicans going forward as they realize how bad it would be for their district.
Thank you, Matt.
Great.
Congressman, I'll turn it over to you for any final comments you'd like to make.
Thank you. Thanks, Janessa. I'm very proud of our staff. Janessa and our team here in the district office work very hard and they do a great job. And if you call here, you'll get somebody during the day who will answer the phone. And sometimes it's me, which is fun. Lately, during the break, I've been doing it a lot. So I just want to thank them. And Matt, thank you for your work. It's really important. Your work as a nonprofit, your evaluation, and I love your introduction about how your exposure to how odd our healthcare system is. So let me just couple things. The healthcare system is also it's inefficient. We could get rid of pharmacy benefit managers. We've had hearings in my committee. We've actually got bipartisan legislation with Republicans to change that. These are the companies 60 Minutes and others have done. They drive the cost of your prescription drugs up as well, and they make money, but they provide no value. Why wouldn't we get rid of them? And then the denials, that's an absolute failure of Congress to take the regulators away. And I've had multiple conversations with doctors around the country who have contacted me in our office, just saying, one, actually somebody I went to college with whose father had the practice, his grandfather had the practice, their primary care family practice in Bethesda, Maryland. And he said, I've seen generations of these same claims be approved and now they're being denied. And I don't have the staff to argue for this, and neither do my clients. So to Matt's observation and mine, this is deliberate. This is just like the mortgage financial market. They know you don't have the resources to fight it. And if nobody's there to help you, you're going to give up, and they're going to take that money that you paid for and had a legitimate contract for them to provide the services, which they did for years, but there's no police around or regulator to enforce it and no resources to them to do it. It's just awful. So healthcare costs are going up and the quality's going down. Same thing's happening with housing, transportation, education. Your 5 fixed costs by economist in your household in America are taxes, housing, education, transportation, healthcare. We all have to pay for that one way or the other. Even if you don't have kids in school, you're still paying the taxes to provide for that. All of those have gone up because we've taken this ethos of just let everybody fight for it themselves and somehow the private sector will make it. And I know this again as a restaurant owner because I watch those numbers, because the first place people cut back when all those fixed costs go up is you don't go out to eat, you don't go out to socialize. So all of that has created this economic mess we're in right now. And unfortunately, because of the President of the United States, his head budget person, and the leadership in both houses, we are at the edge of a cliff for most Americans where we're just holding on. So that's why we're fighting. We can't give in anymore. Every time we've moved to try to compromise, they've gone further away, and we're not doing that anymore. At least I'm not. I'm willing to negotiate in good faith, but we've got to do it in good faith for the benefit of all Americans, irrespective of how much money they have or political connections. If you have any questions and we haven't been able to answer them, feel free to send them by email and we'll do our very best to respond. Matt, if we have any questions that you can help us with, that'd be great. Please continue to be engaged. The other big thing here is how you get information, and there's a reason why I've done more town halls than any other member of Congress. They know that the information you're getting in the information infrastructure we now have on social media is unregulated. So don't believe what you read, and don't believe me either. Go and look at tried and true people who have a reputation for honesty, like the CBO, in this instance, the Kaiser Family Foundation. They're in our neighborhood. You can trust them, and they will evaluate my comments and others, and people like Matt as well. So thanks so much for joining us, and we'll be having another one of these town halls in the very near future, like probably next week.
Excellent. Thank you, Congressman. The town hall will be available on our YouTube and Facebook page if you'd like to watch it again or share it with your friends. Please do not hesitate to call our office if we can be of any help to you. Thank you again for joining us today and have a great evening.
Thank you. Thanks, Matt.